Hello there, soon-to-be parents. Today's video is all about what to expect in the first hours after your baby is born. From the initial moments to key points like skin-to-skin contact, cord cutting, and your baby's first appearance, we'll guide you through the incredible journey of welcoming your newborn into the world. Whether you're anticipating a vaginal birth, an elective, or an unplanned cesarean section, we've got you covered with essential insights and tips. Stay tuned as we explore the magical first minutes and the crucial checks and immunizations that follow. Let's dive into the world of newborns together. Following the birth of the baby, what to anticipate in the first few hours. The most important points. Pregnancy, labor, and delivery, as well as the manner in which your child adjusts to life outside the womb, all play a role in determining what happens following birth. In the event that both you and your infant are in good health, you are able to have skin-to-skin contact with your newborn immediately after birth. In the event that your infant is having trouble breathing or experiencing other challenges, the professionals will determine the type of medical assistance that your infant requires. During the first 24 hours of your baby's life, routine checkups and vaccinations will be administered. Asking your midwife or doctor about them is perfectly acceptable. The first few minutes following the birth of your child. There is typically a lot going on in addition to the moment that your child is born, which is a very important occasion. What happens immediately after birth is going to be determined by your health as well as the health of your child during the months of pregnancy and labor. The manner in which your kid is born and the rate at which your baby adjusts to life outside the womb are also things that will play a role. Birth through the vaginal canal without the use of forceps or vacuum aid. In the first few seconds after birth, the majority of infants begin to breathe and cry. Your newborn can be placed nude, skin to skin, on your chest or belly as soon as possible after birth if they are performing well in terms of their breathing. When you touch your baby's skin, they will remain warm. In addition, it assists in maintaining a constant breathing and heart rate for your infant, as well as initiating your first breastfeed. And it helps you form a stronger bond with your child. The midwife will dry your baby while your baby is on you, and then she will make sure that both of you are covered with a warm blanket or towels. Depending on your preferences, your infant can be dried and then wrapped in warm blankets or towels so that you can hold them. Delivery through the vaginal canal using forceps or vacuum extraction. At birth, the majority of babies who are delivered with the assistance of forceps or a vacuum will breathe and cry. On the other hand, some infants may appear to be a little dazed or slow to breathe, particularly if they were upset during the labor process. If this occurs, your baby will be transported to a specialized warming station by the midwife, neonatal nurse, obstetrician, or pediatrician who is serving your family. They will monitor your kid's breathing and dry your baby during the process. As soon as your infant is breathing normally, you are free to hold them. Your baby can be held against your skin, or it can be dried and covered in warm towels or blankets for you to hold. Both of these options are possibilities. A cesarean section that was performed voluntarily. At birth, the majority of newborns who were born by an elective cesarean section breathe and cry. You are able to have skin-to-skin contact with your newborn if you are in good health and your infant is breathing normally. This should take place before your baby is sent to a specialized warming station to be dried and checked. Before you are allowed to hold your baby, there will be occasions when their breathing will be monitored. While you are on the operation table, you have the option of requesting that your baby be held skin to skin, or they can be wrapped in warm blankets or towels for you to hold over your head. It's possible that you'll want additional medical attention at some point, which means that the initial hug could have to wait. Up until the time that you return to the maternity ward or recovery, your birth partner is able to remain with your child and provide your child with skin-to-skin contact or cuddling. Emergency cesarean section that was not scheduled for. During birth, it is more likely that babies who are born through an unexpected cesarean section may require assistance breathing. During the drying process, your infant will be sent to a specialized warming station by the pediatrician, the neonatal nurse, or the midwife. Your infant will receive assistance with breathing as well as any other necessary medical treatment that may be required. You should be able to hold your baby if you are feeling well and if your infant is breathing well. When you are still on the operating table, it is quite okay to request skin-to-skin contact or cuddling from the operating staff. In the event that you have undergone general anesthesia, you will be permitted to hold your newborn child once you have recovered, provided that your child is operating normally. In the event that your infant requires further medical attention, such as assistance with breathing at birth, it is possible that your infant will be required to head straight to the Neonatal Intensive Care Unit, NICU, or the Special Care Nursery, SCN. It is possible that your first hug will have to wait until your infant is feeling better. Severing the connection. Following the delivery of your child, the umbilical cord must be clamped and then cut. When your kid is healthy, this typically occurs between 1 and 5 minutes after birth. A delayed cord clamp allows you to cradle your newborn infant in a straight position after birth. Moreover, it may be beneficial to the health of your infant. As an illustration, it has the potential to enhance the baby's heart rate and raise the amount of hemoglobin in their blood. The umbilical cord, however, may need to be severed immediately after the birth of the baby. In the event that you or your child require medical assistance, this may occur. As long as both you and your child are in good health, your birth partner will typically be able to cut the umbilical cord if it is something that both of you wish to do. Your partner will not be allowed to operate on the umbilical cord in the event that your baby is delivered via caesarean section, if the baby needs to be transported to the warming station as soon as possible after birth, or if you experience difficulties such as significant bleeding. Clamping and cutting the umbilical cord is what the obstetrician or midwife will do in this scenario. It is not painful for either you or your kid to cut the umbilical cord, despite the fact that it is tricky to do. What your newborn will look like and how they will act after birth. At the beginning of the first few minutes after birth, it is not unusual for your baby to have a blue, purple, or dark red appearance. Within 7 to 10 minutes after birth, the color of your baby's skin will gradually change to pink if everything is going properly with their breathing. The hands and feet of your infant may continue to be blue for up to 24 hours. It takes some time for the blood to circulate properly and color the hands and feet of your baby pink. This is due to the fact that the blood vessels in your baby's hands and feet are quite small. In the event that all goes according to plan, the majority of newborns cry right away. After that, the majority of people will look around with their eyes wide open and in a tranquil manner before falling asleep. However, some people may remain awake and would like to eat. You can give breastfeeding a shot within the first few minutes of your baby's birth if they appear to be ready. When you and your baby are in need of assistance with attachment, the midwife is there to provide it. Developing a healthy bond at your breast is one of the most important factors in ensuring that breastfeeding is successful for both you and your child. All of our videos, including our illustrated guide to nursing, as well as our baby-led attachment film and mother-led attachment video, will show you how. You can also read more about the attachment tactics that are used when nursing. The score on the Apgar scale. Your baby's heart rate, respiration, muscle tone, responsiveness to stimulation, and skin color are all factors that are considered while determining their Apgar score. Each of these 5 criteria is assigned a score of either 0 or 1, and the sum of these scores is referred to as the Apgar score. Apgar scores can go up to a maximum of 10. Whether or not your baby has successfully made the transition from life inside the womb to life outside the womb is what the Apgar score for your baby measures. If your baby's Apgar score is 7 or higher, this indicates that your infant is performing well in terms of their transition to life outside the womb and is in good health overall. However, if your baby's Apgar score is 6 or lower, this indicates that your newborn may require the assistance of a medical professional. In the Child Health and Development book that you have for your newborn, the Apgar scores are recorded at 1, 5, and 10 minutes after the baby is born. What to do if your newborn needs medical attention after birth. In the event that your infant is not breathing well after birth and requires assistance to breathe, if your baby has a low heart rate, below 100 beats per minute, or is floppy, they will be transported to the warming station as soon as possible. The staff will determine the type of additional medical assistance that your infant requires. Through the use of a specialized baby mask and breathing apparatus, a physician, midwife, or neonatal nurse may be able to clear your baby's airways and assist your infant in breathing by providing your baby with normal air. It is possible that the face mask and breathing apparatus will remain in place until your infant is able to breathe on their own. On the off chance that your infant's respiration, heart rate, and floppiness do not improve, it is possible that your infant will require oxygen through a breathing tube or mask. If your baby required assistance to breathe at delivery, they will be transported to the Special Care Nurse, SCN, or the Neonatal Intensive Care Unit, NICU, for additional evaluation and close observation. The majority of infants begin breathing rapidly in response to very straightforward actions such as drying and stimulation. Very few infants require assistance in order to begin breathing. Less than 3 out of every 1,000 infants require more active resuscitation techniques, such as chest compressions, CPR, and medications. Medicines and checkups within the first 24 hours. A pair of name tags will be placed on your newborn child by the midwife during the first hour after birth. Additionally, your infant will be weighed at some point during the first few hours of life. During the process of weighing your baby, the midwife will perform a brief physical examination. When your baby poos and wheezes for the first time, the midwife will make a note of it. Typically, this occurs during the first 24 hours. When your baby receives 1 or 2 shots, you will be asked to provide your approval for them to receive them. Following the delivery of your child, these injections are administered into the thigh muscles of your infant, either immediately or within a few hours. These are the injections. It is possible that vitamin K can assist in the prevention of a bleeding ailment that is brought on by a lack of vitamin K, which is known as hemorrhagic disease of the infant. The only vaccination that is necessary to be administered at birth is the hepatitis B vaccine, which is administered as part of the Universal Childhood Immunization Program in Australia. During injections, your baby may have less discomfort and less agony if you breastfeed them or make skin-to-skin contact with them. If your infant is unable to be breastfed or held skin to skin, you may also find that administering a very little amount of oral sucrose, which is a specialized sweet syrup, is beneficial. During one of your sessions toward the end of your pregnancy, you will have the opportunity to discuss newborn infant checks and medications with your own midwife, general practitioner, or obstetrician. In the first 48 to 72 hours of your baby's life, you will be asked to provide your agreement for newborn screening. This screening examines your infant for indications of disorders that are uncommon but potentially critical. The screening for deafness and hearing loss, as well as the screening for developmental dysplasia of the hip, DDH, will be performed on your infant during the early days of his or her life. As we wrap up this informative session, we hope you now have a clearer picture of what to expect in those precious first hours with your newborn. Remember, every baby is unique, and each birth experience is special. If you found this video helpful, don't forget to like, subscribe, and share it with other parents-to-be. Feel free to leave your comments or questions below, and we wish you all the best on this incredible journey of parenthood. Thank you for watching.